today with Dr. Keely Buesing, and she is with the University of Nebraska Med Center. And so she's a real life doctor that can answer some great questions for us on COVID-19. Keely, want to tell them a little bit about yourself?
Sure. So I'm an associate professor at the University of Nebraska Med Center, Nebraska Medicine, and I'm a trauma and critical care physician who's clinically active and working in these COVID times. So I'm happy to answer any questions that anyone has.
That's awesome. Thank you so much for being here. So how many patients is UNMC treating right now with COVID?
Right now, we have two different units that are treating COVID patients. We have 17 that are up in our biocontainment unit, and then another 10 or so that are down on another unit. Some of those are rule outs. So every patient who we take in who has any symptoms that might be consistent with COVID, we automatically put into isolation and let them out when they're tested. And so those numbers are a bit inflated from the actual COVID positive patients, but those are the number of patients that we're monitoring actively right now.
Okay, and then how long is it taking you to get test results back right now?
It's being done in batches. The average turnaround time is about 24 hours.
Okay, well that's better than the 10 days it was taking at first.
Yeah, no, definitely better. And I hate to say we're even batching it anymore because I believe as of last week or the week before, we've been running it every 24 hours. At first, it was a bit frustrating from our side of life as well, because there just weren't enough patients coming in who needed testing. And so for the laboratory to be able to, handle the number and kind of make it worth running the test, they did it on an every 3-day or so batch basis. And so we'd have to wait a bit longer, but the turnaround time is definitely getting better. So
that's good. That's good. So do you know how many patients are currently being treated in Nebraska or just at your hospital?
I would just know about my hospital. I do know of the number of cases in Nebraska. Total is around the 500 range. The number of deaths sits around 12 or 13 as of this morning. The number of patients being treated in each hospital, though, I don't have those exact numbers.
Okay. So does your hospital have enough protective equipment should those numbers rise?
We do right now, which is very nice. And it's at this point, a big thank you to the community because there's been a huge outpouring of donations, as well as people, making cloth masks. I would say definitely keep some of those for yourself because the CDC does have that recommendation out to, wear a cloth mask whenever you're public facing, say going to the grocery store or doing anything out in the community. So definitely please keep one of those for yourself, one for your family. But right now we're doing A-OK on protective equipment. We're running a bit low on germicidal wipes or disinfectant wipes. And so if there's anyone out there who happens to have a huge stockpile that they know about, please donate to UNMC. We'd be more than happy to take them from your hands.
Yeah, absolutely. And you need them so much more than the individual people out in the world who might be hoarding these things. So when you look at Nebraska's numbers, I mean, we're relatively low compared to the other states. Do you expect those numbers to stay low? Are we doing enough with social distancing to keep those numbers down?
I think we have yet to see our peak here in Nebraska. However, I think that peak is going to be very attenuated compared to our original numbers that we were projecting. That comes not only from me, but from our healthcare administrators who have meetings on a local, regional, and national basis every day. So the original projections that we were looking at were in the double-digit thousands to on up to 100,000 as far as cases here in Nebraska. I think that has been very much flattened. We've done a great job of flattening the curve from everyone staying inside. But we have, as of information this morning, we are yet to see our peak here in Nebraska. Another couple of weeks.
So you think a couple more weeks before we'll see that?
Yeah, unfortunately.
Okay. So right now they're kind of, the dates that they give keep changing, obviously. And right now they're kind of saying the end of April. Do you think that that will be sufficient to hit our peak and go back down and then maybe we can get back to life as normal somewhat?
Yeah, so right now, based upon the projections, our peak should come around April 25th is what the latest kind of projected date is. That's a moving target, so I don't want anyone to fixate on that. But all the numbers right now point to us being able to eventually go back to life as normal. What life will be like and what the new normal is a bit of a moving target as well at this point. I don't think we can go back to, as unprepared and as unaware as we were before COVID. I think everyone continues to need to do a bit of social distancing and just be careful about their own health when we are eventually able to return to that.
Right. Yeah. Well, and there's all this fear that then once they say, okay, you can go back to your jobs, you can go back to your normal lives, and people are going to concerts and big events and traveling again, do you think it will come right back? Is that what they're predicting?
It's never going to go away. As far as it hitting society as hard as it has this time around, I don't think we'll see that again. Again, for a couple of reasons. Hopefully by then we'll have vaccines. As far as when the next wave of COVID hits, we'll have people who are being more careful about their own health and the health of others in the community. So I don't think we'll ever see it hit society to such a degree as it has this time around. However, it's not going to go away. It's just something, it's a virus just as the flu is that continues to evolve and comes in cycles. And, we're going to see the second wave later this year. We'll see the third wave probably next year. And that's from information from Tony Fauci, who is the, kind of famous guy who's on the White House conferences. Also Dr. Bricks, who has done a wonderful job of disseminating information on a national level. I don't want people to be afraid, though, just because I say that. I don't think it will ever hit the community as hard as it has hit this time around. It will be very much to a smaller degree, but it's something that we all need to keep in mind.
Yeah, absolutely. Well, and, just the flu and everything else that we spread around every year, the more conscious we are of washing our hands. It's funny, we have to go back to preschool, wash your hands, and not touching people that we don't need to touch, not touching things we don't need to touch. I mean, that's going to be good all around for our health. Yeah.
No, very much so.
So what do you think about transmitting the virus? So I know people have different levels of fear. Sometimes people are afraid to even touch their mail or touch packages that have come, going to the grocery store, touching produce. I mean, how scared do we need to be about what we're doing when we're outside?
So I'll tell you what I do. I'll tell you what I recommend to people. Any deliveries that come to your home that have been touched by a member of the community, just go ahead and spray them down with a disinfectant. That can be something as simple as just a spray bottle of isopropyl alcohol or rubbing alcohol. Can be a, Lysol spray, works great if you're able to get your hands on it, of course. But I would say be careful. It's no longer something that is seen as offensive to anyone. As far as, we just had our groceries delivered this morning. And we sprayed down all of those bags and all of those groceries. And it's just kind of known that, hey, the people who are delivering to your home, they're not going to say hi. They're not going to want to shake your hand. They're not going to want to give you a fist bump. And it's okay. They're protecting themselves. They're protecting you. And so to continue that protection and continue protecting your family, it's reasonable to spray everything down. As far as going out into society, into community, doing what you need to do on an everyday basis, wear your face mask. Gloves are great if you happen to have them. I would say just regular hand sanitizer, taking out a small carry bottle of that and using it on your hands is absolutely protection enough. It's a really weeny virus. And that I say after talking to several infectious disease colleagues. It, just like you said, it's going back to preschool. Wash your hands, use hand sanitizer. It's a virus that does not stand up to those disinfectants and antimicrobials. So just be careful about it. If you do want to use plastic gloves when you go out into public, hand sanitizer can be used over those. And then also when you take them off, it's smart for protection.
Mm-hmm. Yeah. And as we're showing houses, we've been doing that. I think most agents are doing that anyways. I'm taking gloves with me every time I go, and shoe covers, booties, use hand sanitizer before and after going into a house. Trying to touch as little as possible. So we're trying to be safe about it because our jobs are one that you can't do all of from home. People still want to see the houses. Do you think that that's safe and responsible that we're still doing that?
I would say yes, and especially if you're taking those measures to help protect yourself and help protect your clients. I have heard that, and you would know more about this, I've heard that a lot of people are doing virtual house tours. I don't know how
Mhm.
popular that is here in Nebraska, but that would be probably the safest way to go about showing a home. But I don't think there's anything that is unreasonable or unsafe about showing homes in person if you're taking those precautions.
Yeah, and we are doing a lot more virtually when possible, but sometimes people aren't comfortable making a buying decision without actually stepping into the house. So when we absolutely have to, we are still doing that, but just taking precautions to keep ourselves and our clients safe.
I can definitely understand that. It's a huge chunk of change to lay down without seeing something in person.
Yeah,
So
it really is. And, we can do so much virtually. And, we're doing the 3D Matterport tours and the video tours of the houses. And sometimes we even do like FaceTime with our clients and show them the houses. But it's a scary thing to spend that much money without actually being in the house. So sometimes we still have to do the in person showings.
that's understandable. It getting the feel of the home is a little difficult to do virtually.
It is. It is. So, what is your opinion on or knowledge of some things I read say that when somebody coughs or sneezes, that it can stay in the air for a little while. Other places say it pretty much is just on surfaces. What are your thoughts on that?
The data is mixed, and so I understand where people's confusion comes from. I do. I would say to be safe about protecting yourself. Just assume that someone sneezing, someone coughing, that can stay in the air for as long as it needs to get to your mucous membranes, meaning, you inhale it, a little droplet touches your eye, you get the droplets on your hands, and then you touch your eye. It's not enough is known right now to be able to say, okay, after 3 hours, you're okay to touch cardboard, or after 6 hours of someone sneezing, you're okay to just, go about the room without a mask on. What has been shown is that it can live for hours in the air and on surfaces. And so unless you're absolutely sure that the air that you're breathing hasn't been sneezed in by someone for a good 3 to 6 hours, I would just be safe.
Yeah, well, and that goes along too with wearing the mask. I know that's more for people who are sick to not transmit it to others, but does it also offer some protection for you to not breathe in some of that germed air?
It does, and especially when we're talking about surgical masks. So the cloth masks are a bit different because they're more porous, and so they can actually hold on to the virus a bit longer, hold on to a live virus a bit longer than a surgical mask or an N95 mask, any of those commercially available masks can. But it does offer some protection as far as trapping the virus and not allowing it to actually, it's the touching of the mucous membrane. So the lining of the mouth, your lips, your nose, your eyes, that's what transmits the virus to a human. So it does offer some protection from that virus being able to get to your mucous membranes.
So we recently heard about a tiger at the Bronx Zoo that got it. Previously, we were being told that animals couldn't get it or transmit it to humans, and now that doesn't necessarily seem to be the case. What do you think about that?
I think it's unfortunate, number one. I think the one tiger plus a few of its, let's say, colleagues there at the Bronx Zoo have tested positive for the virus. So they've actually done the most testing over in China on whether or not animals can have the virus transmitted to them, be carriers, and also transmit back to humans. So they've tested goats. I'm probably going to misquote on it. I know they've tested dogs, but they've tested goats, sheep, pigs, horses, cats, and ferrets. And they've shown that the only animals who are able to have the viruses transmitted to them, as well as transmit the virus back to a human, were cats and ferrets. Now, of course, the tigers in the zoo up in New York are a bit different, or so we think, from our domesticated cats, but they're really not. They all go back and share the same common DNA. And so the answer is yes, that we can transmit the virus to our domesticated cats, as well as ferrets. I know some people have ferrets as pets, and we just have to be careful about that. If you're positive for COVID, just know that you can transmit it to your feline and your ferret friends there at home. And be careful about, a lot of people, especially in rural communities, have cats who tend to roam or are outside cats. Be careful about those cats and maybe bring them in for the time being so that they can't be around other animals who may transmit to them as well as transmit back to yourself.
So what do you think about the dangers to animals? I know they said the lion had like a cough, but have you heard of any animals actually dying from COVID, or is it not as serious to them?
I haven't heard of any animals dying from COVID. And the animals, the tigers up in New York, are recovering. I think there are 4 or 5 of them who actually tested positive for COVID. All of them are recovering, but they all showed the cough, the main sort of herald symptom of COVID, the respiratory virus. And so it's fortunate that they aren't dying and they aren't as susceptible to it as humans. But then again, we haven't been testing all animals who have been in those zoo communities.
Mm-hmm.
So they may be carriers and may just not be showing symptoms.
Yeah, well, it'll be interesting because I think people are so attached to their pets. The thought of giving it to your pet and making your pet sick might actually be more serious to a lot of people than, if their kids get it or somebody else in their family gets it. Like, God forbid the cat or the dog gets it.
Fine if the husband gets it, but my dog, no. No,
At least dogs can't get it because you and I both have dogs.
Dogs can't get it. No. No, the pets are part of our family. I completely understand that. Just be careful around them, just as you would. Well, maybe as you would, or maybe more so than you would your human housemates.
Yeah, no, that's good to know. So when we look at people who are getting it, like, what are the main issues that people have as underlying causes that make it be so serious for them?
I used to say and used to believe that it was underlying comorbidities, meaning if you have diabetes, if you have any respiratory issues, including asthma, if you're just generally unwell or elderly. But more and more as the day goes on, it is being proven that even young, healthy people can get COVID, become symptomatic from COVID, and also die. There was just the 27-year-old greeter, I'll probably misquote the store that she was at, but I'm thinking it was Walmart, that died within the past week from COVID. And she, to my knowledge, was otherwise healthy, maybe had some very mild asthma type symptoms or allergy type symptoms as we're going into allergy season, of course. Anymore, all of us, I would just, go in the baseline that all of us are susceptible to it. Everyone has to be careful, and just go about your day prepared.
So do you think there's a difference in symptoms, like for kids? One of my friends actually asked about, like, is there certain things we should be watching for in our kids? Will they show symptoms differently than an adult would?
They don't. Kids are less likely to show symptoms, but just as likely to be carriers. They, with their young, healthy immune systems, unless they have other medical problems, they just aren't showing the symptomatology and aren't as susceptible to the serious consequences of COVID. So with kids, I would say, be careful about who they're hanging around. I think Nebraska and Omaha has just closed their parks. But I know kids are wanting to hang out with their friends and catch up to all of us want to. The best way to do that is social media. It's the safest way to do it. But otherwise, it seems to have the same symptomatology in kiddos. So just watch out for the cough, the fever, and other respiratory type symptoms that can pop up.
That's good to know. So what do you think about a vaccine? Now, from my limited medical knowledge, it usually takes about 18 months to get a vaccine approved and out to the public. Is that what they're thinking for this also?
Yeah, there's been a huge push from the government to fast track vaccines, any research that has to do with COVID and COVID support measures. So that is one bonus, that it may not take as long as your normal vaccine would to get to the public. I don't think that's a bad thing. A lot of people have been questioning, hey, if we fast track this vaccine, are we going to see a lot more complications as a result of that vaccine or a lot of side effects from that vaccine? I don't think that's a bad thing. The fast tracking, because it still is very well vetted, very well tested in humans prior to being dispersed for public consumption. And so I don't think that there's going to be a huge increase in side effects, issues from getting the vaccine. Realistically, though, the vaccine before the fall of this year, I don't see that happening. I think it's optimistic in a way to hope for a vaccine by, say, August or September of this year. I, just as well as, you know, every other healthcare provider in the community, as well as the entire community, is hoping that I'm wrong. I would be happy, very happy to be wrong on that point. But they are actively and around the clock working to get a vaccine out to the public.
Great. So is UNMC doing research on a vaccine right now, or is that being done other places?
I think UNMC has been doing some research on the vaccine. They've been doing more research on treatments for COVID and COVID symptoms. There's a couple of groups who are doing some active research that are reaching out onto a national level as well. So, but as far as vaccines at UNMC, I'm not aware of any group specifically targeting that.
So are they doing testing on Donald Trump keeps talking on the news about different medicines that were previously used for other things that are being effective on COVID? Is that the kind of things that they're testing at your hospital?
Yes and no. So the hydroxychloroquine, the malaria drug, is the big one, and its counterpart chloroquine are the two drugs that Trump has, as of last week when I was watching him on a daily basis. Those were the two big ones that he was touting. Those have not proven efficacy, not proven safety in COVID. And so anyone who has those, because people do, especially, you know, people who do mission trips abroad have those laying around the house sometimes. I would not advise to take those in any effort to ameliorate or prevent symptoms or testing positive for COVID. It doesn't work. It hasn't been proven. There are some antivirals, remdesivir. And I honestly don't know if I'm saying that one right, because I'm not a virologist. I'm not an infectious disease doc. But there is one antiviral, starts with an R, that's being tested on a nationwide basis that is proving some efficacy as far as preventing the severe symptomatology of COVID. That is showing promise. But those, again, are very early on in trials.
Have you heard anything about them doing more widespread testing here in Nebraska?
Sure. Yes, more widespread testing is becoming available. UNO, so University of Nebraska at Omaha, is actually opening up a drive-through testing site that will be up and running as of this Saturday to be able to take patients or just people out in the community who think that they have been exposed or are experiencing symptoms that are consistent or possibly consistent with COVID. And so that is one testing site that's newer, that's opening up in our own community.
That's interesting. I hadn't heard that yet. That's awesome. So if you think you have it, then maybe you could go to that testing site, but you shouldn't just, if you're healthy and you don't see any symptoms, there's no reason to go get tested.
Right. And I would say before going to the testing site, if you have a primary care doc, the best thing, the absolute best sort of line of action to take, if you think that you may have been exposed or experiencing some symptoms that you think may be consistent with COVID, call your primary care physician. Those are the family practitioners, the internal medicine docs. Call your local hospital. So at UNMC, we have a hotline where you call into the regular UNMC number, and it will direct you to the COVID hotline where you can sort of vet your symptoms or pass your symptoms by a healthcare practitioner who will then let you know if you should go and be tested. I think if the community as a whole, kind of floods the UNO drive-through testing facility, it's very likely that it will be overwhelmed very quickly, and that's the last thing that we want. And so primarily you should call into a healthcare provider, run your symptoms by them first, and they will let you know whether or not you should go be tested.
Yeah, that's good advice. I think a lot of people just want to be tested just to know, but then you're taking that test away from somebody who may legitimately need it.
Right. And since right now we have the capacity to run around 300 tests a day here in Nebraska and in Omaha, And so you can see that if you just look at our population as a whole and look at the population of Nebraska, how that capacity can very easily be overwhelmed. And so that's why I would reinforce to the community that the safest and the most responsible thing to do would be to run your symptoms by a healthcare provider first before either going into the emergency room or going to one of these testing sites.
Yeah, absolutely. That's good advice. That's all the questions that I have. Do you have anything else that you think is really important that people in the public should know or do, or advice?
You know, I think we ran through most of the questions that I hear on an everyday basis. If anyone else has questions, I'm happy to continue to answer them offline. If you just want to forward them to me, that's absolutely great. But, you know, in any of these interviews that I give, I just want to say a big thank you to the community. It's been overwhelming and it's been heartwarming for us on the front lines, just having that outpouring of support. From donations, from, you know, well wishes on the internet. It sort of restores our faith in humanity and lets us know that everyone is in this together and we're all fighting the same fight. And it gives us the willpower to go into work and face another day. And so thank you to the community, and thank you to your watchers and everyone who may see this in the future. We very much appreciate it, and your love is very well felt, even though we can't be together right now.
Well, we really appreciate you putting yourself every day, even without COVID, you know, in a position where you're helping people every single day. And then especially now, I mean, there's an added risk to you as a healthcare professional. And we just can't thank you enough for everything that you do for your patients and the community as a whole.
It's what we do. We're happy to provide it.
Yeah. Well, thank you so much. I appreciate you taking time with me today, and I hope that you stay safe and stay healthy and take care of yourself.
Thank you. Thank you for having me on. I hope you and your whole community takes care and just, you know, do quarantine with a passion. You know, heck, we're on this together. We'll get through it.
Well, and enjoy it, because it's going to come to an end. And I know we all hate being stuck at home, but then when we get busy with our everyday lives, maybe we're going to miss this time that we had with our loved ones.
I'm a diehard introvert, so I'll miss it.
I know it is nice staying home a little bit more often, but even me being a little bit of an introvert, I'm ready to get back out in the public again.
Me too. I can't wait for this to be over and to actually like go out and have a drink with my friends,
Right.
you know?
Yeah, through it. Absolutely. Well, thank you so much.
Thank you. We'll see you later.
All right. Take care.